And for our next presenter is Dr. Ming-Nan Lin, the Vice Superintendent of Dalin慈济Hospital. And his topic today will be Compassionate Companionship Training Program Enhancing the Capability of Clinical Buddhist Chaplains in Providing Service at Serene's End of Life Care. Let's welcome Dr. Lin.
Distinguished guests, ladies and gentlemen, it's really my honor to be here to share with you. We cooperate with the Lotus Foundation to have the training program for the clinical Buddhist chaplain. First of all, I want to take the chance to thank Shi Pu An Fa Shi, Dharma Master Shi Pu An, because she is a key person in establishing the training program in our hospital. She is a leading Dharma Master of our clinical chaplain, Buddhist chaplain training at Dalin慈济Hospital, and also now assistant professor at Nanhua University, and also she's a supervisor of clinical Buddhist chaplain training program in Buddhist Lotus Social Care Foundation. And you can see here, this is in our hospital. You can see the symbol. This is a Chinese character is love, I. And then you can see the pigeon here with the English love here. And then there is a heart. And this is a mathematical symbol, infinity. So the love of heart is infinite. It is taking care of the patient is also showing the love to the people in suffer. So we'd like to invite all of you to come to our hospital in our hospice ward to see what we have done for our patients. And then the practice of Bodhisattva's path in human world, I think that taking care of the palliative patient, the terminal illness patient is the best practice, the area for us to practice the Bodhisattva's path. Because in the hospital care, this kind of program is like a humanistic spiritual practice ground to provide us to show our love, show the compassion. And then it is the way that we can learn and transmit the Dharma. We get a self-cultivation and helping others achieve enlightenment, 济度度人. And then in the Lotus Heart, or we call it the hospice ward in Tzu Chi is we call Lotus Heart, 心莲. It is training through encounter situation. Because here you can see so many people in suffering, and then they will face a lot of problems, physical problems, psychological problems, and also social supporting system, and also spiritual problems. So it is a world that you can encounter all these kind of situations. So you can train through when you're facing these kind of situations. And then from the place of suffering, you can achieve your Puti Xin, Buddha mind. So the road to compassionate companionships is we have the training program for the CBC Clinical Buddhist Chaplain, and then through the clinical services, because the CBC Clinical Buddhist Chaplain work with us, the team, with the doctor, with the nurse, with the psychologist, with our volunteers, with social workers, even pharmacists or nutritionists. We work together to give comprehensive services, biopsycho, social, and also spiritual services. And then besides that, we are also placed that we can train the faculty for CBC. And just like Professor Huang said, that the training program of clinical Buddhist chaplain, we have like 4 steps. The first one, we have a basic course, 28 hours basic level and 28 hours of advanced level lecture and discussion. And then we interviewed the trainees if they are still willing to get this kind of training. So after that we have clinical leadership in the hospital for 10 days. And then they have to report and pass the exam to pass the primary exam to qualify for clinical Buddhist chaplain training. And after that, they got a certificate for a clinical spiritual care provider. And then after that, if they are still willing to receive more advanced training, we have this kind of advanced training program for 15 weeks, like Professor Huang said that. And then we have on-site evaluation and training report later I will show you. And then there is the advanced exam. When they pass the advanced exam, including written tests, clinical tests, and also OSCE, and they got certified as a clinical Buddhist chaplain. So totally is 680 hours. And this is a training framework. As you can see here, this is written in Mandarin. The first one, you need to take care of the patient. So in the ward, share care to other hospital ward, and also home care. This is we call clinical services. They have to go with the team to provide services for that. And there is a mentor, the leading Dharma master, the mentor to guide them or discuss with them how to provide this kind of spiritual care. And then we have that teamwork in the ward, palliative ward. Every, like in the morning, there's different kind of activity designed for the patient and their family. And then if they have wishes, and they have like we call 4 thanks, 世道人生, say thank you, say goodbye, say sorry, and then this kind of activities for patients and their families. And then there's so many meetings, so many discussions in the ward, in the hospital, palliative ward. Like we have morning meeting every morning, and we have home care, we have shared care discussion every month, once every month, and there's we have national teleconference every 2 times a month. There are like more than 50 hospice ward in Taiwan. They take turn to report cases and share experiences, and they have to participate this kind of meetings. And we also cooperate with the Lotus Foundation, have some case discussions. So they have to just like training a resident. And then the education is like this basic training because they work in the hospital, so they have infectious control, how to write in the chart, and then the introduction of spiritual care, and then work with, so they have basically with doctors, nurse, social worker, and volunteers. And then the professional training is like clinical ethical issues discussion, and then frequent clinical questions like patient have pain or dyspnea, whatever this kind of clinical problem they have to know to some extent, and then how to search the data. If they have some question they want to understand more, we will share with them how to search the database, and then they have to report cases on a routine basis, and then they have to we have we call reading clubs, report to the reading of the books, and then this kind of like live retrospect, live review, and companion communication skills, empathies, and self-inquiry, and this kind of work is the professional program, just like a resident. So this is, I'll show the pictures. We have routinely every week, so we have a team meeting in the ward to discuss some difficult patients and their families. And this is our head nurse, our doctors, and our volunteer. We work all together, participate. Different professions' opinion in how to improve the care of the patient and their families. And there's interprofessional training. We have psychologists, dietitian, pharmacists, and then when they have cases, they have discussed, and then there will be feedback. Even in the hospital, this is a Christmas party. The Buddhists also join this kind of Christmas partly because we not only for the Buddhists, but also we have Christians, so we also provide this kind of activity in the world. So the compassionate companionship, this is in when the patient is going to die and they want to have the Buddhist conversion, we'll hold this kind of rituals in the bedside. And then when the patient pass away, how to provide grief relief for their families. So we will have this kind of home visits, not only for the patient, but when they pass away, we also provide this kind of relief, grief relief for their family. Work with the team, doctors, nurses, social worker, and also the chaplain. And then we have Buddha Hope in the world. So when the patient is okay, that we can go there for Buddhist conversion. And then I would like to thank Dr. Wang Yingwei because they provide these clinical case records. The system is from Hualien. So when they are taking care of the patient, they need to do some written some record, and the mentor will review what they have right and discuss with them how to make a better care. So we have a training handbook. This is a case. The book is published. Professor Huang has already talked about this book. And also we have this handbook for the training, including all the items I have been shared with you. They have to fill all everything that we need to complete. They need to complete this handbook. This is the first OSCE in Taiwan for medical students, for PGY when they have the bar exam, they need to have passed the OSCE, and then this is the first designed OSCE for our clinical Buddhist chaplain. So they have observer here, 考官, the teacher, and then after that we will have discussion. This is not the national standard but this is we design this OSCE. What kind of cases, what kind of situation that the clinical Buddhist chaplain will meet. So we design OSCE situation, and they have to practice and then also pass the exam to get the certificate as a clinical Buddhist chaplain. So this is the slide has been shown. This is examination of clinical Buddhist chaplain. And then we now, not only the 4, but we have more chaplain being trained in our hospital. We can extend the compassion to those in need. Now this is my final slide. If you want to walk fast, walk alone, but if you want to walk far, walk together. So we need to have more clinical Buddhist chaplain to serve the people in suffering. I would like to say that our master, Dharma Master Zheng Yan is our leaders. So we are very grateful to Venerable Master Zheng Yan because he created the places, the A hospital for us, that we can, provide this kind of compassionate companionship for the people in suffering. Thank you.